Hello everyone, welcome to Health Bites, that YouTube channel that tells you about health conditions, what they are, what might cause them, how they might be treated, how they might be cured, if possible, and how they can be prevented, if possible. So today we are going to talk about abdominal pain. So the most common kind of abdominal pain is a stomach or what we call a belly ache, which happens from time to time throughout our lives. Most people, if not all human beings, experience abdominal discomfort or pain at some time in our lives. It is usually felt in the part of the trunk below the ribs and above your pelvis and the groin, and can range in intensity from a mild ache or nausea to severe acute disabling pain. People with abdominal pain often double over, clutching their stomachs, feeling nauseated or dizzy, and try to avoid food and water. So that's how bad it can be at times. While we don't usually feel inner workings of our abdomen, pain occurs when there is a disruption of the normal functioning of the organs and tissues inside, including the stomach, small intestine, colon, liver, or gallbladder, spleen, and pancreas. The most common kind of abdominal pain is a stomach or belly ache, as it is most commonly called, which happens from time to time throughout our lives. While abdominal pain is normal, it isn't necessarily serious, and it often resolves itself. So sometimes we might not even remember that we have had a belly ache. The first step to addressing mild stomach pain is not associated with a medical condition or trauma, is to try and identify and avoid the trigger. For example, overeating or eating food rich in gas inducive properties can cause heartburn, distended stomach, and abdominal pain, which can be avoided by practicing dietary changes and moderation. Some people find relief from stomach aches by lying on their left side, which may ease pressure on your digestive tract. You can prevent discomfort further caused by constipation by consuming fiber-rich foods and increasing your water intake. Some women experience severe cramping and pain with their monthly period. Because stress can increase stomach acid, staying calm and practicing deep breathing can also help your belly stay pain-free. If your lifestyle or behavior changes don't resolve your abdominal pain, the next step is to consider over-the-counter pain relievers, such as laxative or antacids. Be careful to avoid non-steroidal anti-inflammatory medications, such as aspirin, ibuprofen, and naproxen, because these painkillers can cause stomach upset, irritate your gastrointestinal tract, and may even cause bleeding ulcers. Your doctor or pharmacist can suggest alternative pain relievers that won't bother your stomach. If abdominal pain is severe, persistent, or accompanied by a fever, watery diarrhea, vomiting, a bloody stool, jaundice, or belly tenderness or swelling, please call your doctor or healthcare provider immediately, or just find yourself to the doctor. Such complaints could indicate a serious underlying condition or internal injury, and might require treatment by a specialist or surgery. If you can't reach a healthcare provider, you should consider going to the medical emergency room. Exercise, eat a healthy diet, and avoid smoking and consuming excessive alcohol to reduce the chances that you will experience certain causes of stomach pain. Good hygiene, especially hand washing and avoiding materials and foods contaminated with viruses and bacteria, will also help to reduce your chances of developing illnesses caused from infectious causes. So, what might cause an abdominal pain? Okay, there are as many causes of abdominal pain as there are degrees of discomfort, and the location of the pain often indicates its cause. For example, a sharp pain in the stomach, lower abdominal pain, pain on the left or right side, intestinal pain, or stomach cramps can all suggest clues to underlying conditions, as can their timing and severity. Abdominal pain can be caused by inflammation of, for example, diverticulitis, colitis, or appendicitis, or organ distension or stretching, for example, obstruction of the intestine, blockage of the bile duct by gallstones, swelling of the liver with hepatitis, or by a loss of blood supply, for example, ischemic colitis. Some prescriptions and over-the-counter medications and dietary supplements can also cause stomach pain. Medications can irritate your stomach, causing bleeding, diarrhea, pain, slow down your digestion, causing constipation. Be sure to check the label to see if the medication you are taking has abdominal pain as a side effect. So we all know that medications that we take, most if not all of them, have side effects. You normally see it advertised on TV. A medication might be good for something, but it always has side effects. So some causes of abdominal pain might include, but not limited to, indigestion, constipation, a stomach virus, and for women, menstrual cramps, irritable bowel syndrome, also known as IBS, food poisoning, food allergies, gas, lactose intolerance, ulcers, pelvic inflammatory disease, a hernia, gallstones, kidney stones, endometriosis, Crohn's disease or ulcerative colitis, a UTI, also known as urinary tract infection, gastroesophageal reflux disease, also known as GERD or GERD, however you want to pronounce it, appendicitis, diverticulitis, cancer, which is normally of the liver, stomach, or your pancreas. So, symptoms of an abdominal pain might include symptoms that commonly occur with abdominal pain include back pain, chest pain, constipation, diarrhea, fever, nausea, vomiting, cough, and difficulty breathing. Characteristics of the pain, for example, sharp, cramping, radiating, the location of the pain within the abdominal wall, and its relation to eating, vomiting, constipation, or diarrhea are all factors associated with symptoms. Symptoms associated with abdominal pain might include you might get a fever, inability to keep food down for more than 2 days, any signs of dehydration, inability to pass your stool, especially if you are also vomiting, painful or unusually frequent urination. Your abdomen is tender to the touch. The pain is the result of an injury to the abdomen. The pain lasts for more than a few hours. Bloating, belching, gas, flatulence, or farting, whatever you want to call it. Indigestion, discomfort in the upper left or right, middle or lower left or right abdomen. Constipation, diarrhea, GERD, which is gastroesophageal reflux disease, heartburn, chest discomfort, a discomfort in your pelvic area, a loss of appetite. More serious symptoms might include, but not limited to, severe pain, blood in your stool, persistent nausea and vomiting, unintended weight loss, your skin might appear yellow, severe tenderness when you touch your stomach, swelling of your abdomen. So those sound quite serious. Well, those are quite serious. So how is abdominal pain diagnosed? The cause of abdominal pain is diagnosed on the basis of its characteristics, a physical examination, and testing. Your doctor/physician is likely to ask you a series of questions about the characteristics of the pain, the patterns and persistence of the pain, and whether you have any underlying physical or mental conditions that could be contributing to your abdominal pain. So ways in which abdominal pain may be diagnosed include a physical examination, lab tests, which include a complete blood count, CBC, liver enzymes, pancreatic enzymes, amylase and lipase, pregnancy and urinalysis tests, x-rays of your abdomen, radiographic studies. You may also do an ultrasound, computerized tomography, which is also CT of the abdomen. This includes all your organs and your intestines. An MRI, which stands for magnetic resonance imaging, barium X-rays, capsule endoscopy. Endoscopic procedures included esophagogastrostomy. Wow, this word is spelled ESOPHAGOGASTRUDENOSCOPY. I'm gonna try and pronounce this. Esophagogastroduodenoscopy, or EGD, colonoscopy or flexible sigmoidoscopy, endoscopic ultrasound, also referred to as EUS. So for those who want to look up the term of that word that I had a problem pronouncing, the word is spelled ESOPHAGOGASTRODENOSCOPY. So if I try to pronounce that again, it could be esophagogastroduodenoscopy. Wow, what a tongue tire. Okay. Treatment methods for abdominal pain. The treatment for abdominal pain depends on its cause. Treatments can range from medications for inflammation, GERD, or ulcers, to antibiotics for infections, to changes in personal behavior for abdominal pain caused by certain foods or beverages. In some cases, such as appendicitis and hernia, diagnostic tests such as analysis of blood, urine and stool samples, CT scans, and endoscopy may be required to rule out or confirm a specific diagnosis. And afterwards, surgery might also be required to correct these problems. So treatments might include over-the-counter pain relievers, prescription medications for inflammation, GERD, ulcers, or general pain. You might be also required to get antibiotics, low-dose antidepressants, changes in your behavior included elimination of certain foods or beverages that may be contributing to your abdominal pain. And last but not least, surgery to remove intestinal blockages, hernia, or infected organs. So that ends this section of what is abdominal pain, what might cause it, and treatment methods, and how it can prevent it if possible. So if you like my material, click that subscribe button, click the bell notification so that you'll be notified every time I release further health terms material. In my video description, I also have links to other stuff that you might consider purchasing and having a good read to support my channel. So until the next time, this is Health Bites. Good evening.